Okay, good morning to Emeritus Professor Tan Sri Dato, Dr. Mohamed Salleh, Mohamed Yasin, Emeritus Professor Dato, Dr. Lokman, and all the audience. Welcome to today's webinar with the title, The Importance of Higher Qualifications for Healthcare Personnel, organized by Department of Student Affairs, KPJUC Healthcare University College. So I'm Dr. Tan Siang, Dean School of Pharmacy, KPJUC, and I will be the moderator for today's webinar. And for all the information, right, we strictly comply the SOP with the 1 meter part. And definitely with the audience, we have a many meter KM apart from you. So pertaining for today's title, right, healthcare personnel comprise a wide varieties of the professions and occupations who provide many types of the healthcare services, including such dialect care practitioners as physicians, nurses, pharmacists, speech language pathologists, audiologists, physiotherapists, occupational therapists, physical and behavioral therapists, as well as allied health professions such as phlebotomists, medical laboratory scientists, dietitians, and many others. They form an important workforce in medical and health sciences, and they work in hospital, healthcare center, and other service delivery points, but also in academic trainings, research and administrations. Healthcare professions may also be a public health or community health practitioner. COVID-19 pandemic has exposed us to the importance of working together as a team among medical and healthcare personnel in the management of this disastrous healthcare crisis. We already know very well the important role of medical personnel like the doctors and medical specialists. They are highly skilled clinical work and values higher qualifications and fellowship. Today, we would like to highlight the equally importance, the role of other healthcare professions in providing patient care and healthcare services. In Malaysia, except for speech therapists, audiologists, and other healthcare personnel, most of the qualifications and clinical training are offered at the diploma level. For example, diploma in pharmacy, diploma in nursing, diploma in medical imaging, and etc. So in this webinar, we are going to focus on the discussions, the importance of higher qualifications among healthcare personnel. Because the healthcare industry is continuously evolving, knowledge and technologies consider best practice today, but can change drastically in just the span of a decade. Why should a nurse or physiotherapist have a bachelor degree, master degree, or even a PhD? This is a topic that is seldom discussed. We are very fortunate to have both two emeritus professors to discuss this topic today. So I would like to introduce the speaker. The first speaker on my left is the Emeritus Professor Tan Sri Dato Dr. Mohamed Salleh, Mohamed Yasin. He is former Vice Chancellor of UKM. I'm sure that on the screen, perhaps the UKM graduate, right? You received the scroll from the Vice Chancellor before. Yeah. And he was the founding Dean, Faculty of Health Sciences, UKM, which was the first such a faculty in Malaysia. He was the founding Director, International Institute for Global Health, United Nations University. He was former Chairman of MQA. And the second speaker, Emeritus Professor Dato Dr. Lokman. He is the Vice Chancellor of KPJUC Healthcare University College. He was former Dean of Faculty of Medicine and was also Dean and Director Medical Center of UKM. He is an ENT surgeon. Perhaps maybe some of you received his this specialist procedure at KPJ Tawaka before. Yeah. And famous of his clinical work in the management of the deaf, children and adults through this cochlear implant surgery. Without further ado, let us begin today's webinar. Perhaps for the first question for Tan Sri. In 1992, UKM became the first university in Malaysia to establish the Faculty of Health Sciences. At the time, we call it as a Faculty of Allied Health Science. Could you tell us the reason of the establishment of Faculty of Health Sciences? A bit about this history and personal experience in the establishment.
Good Good morning, all. Thank you very much, Dr. Tan. Thank you for the kind introduction. But I'm also thankful to Prof. Lokman, who used to be my former student. Yeah. But I was young when I started lecturing at UKM, and Prof. Lokman and I were even in the same football team. So that's been a long time ago. Now, in 1992, we were able to establish the Faculty of Allied Health Sciences at UKM. And the reason behind establishing the faculty was, firstly, there, even in the 1990s and earlier, there was an explosion of new knowledge in health sciences and medical sciences, and this necessitated training of personnel at a higher level because of this massive explosion of knowledge. Now, secondly, there was also this advancement of medical technology and also medical techniques and diagnostic procedures, which again necessitated training of allied health personnel at a higher level. There was certainly at that point in time clear gaps between so-called allied health professional and also the medical profession in Malaysia. At that point in time, the medical professions had a clear pathway of being trained to be highly specialized, and yet for the allied health personnel, it was only up to a diploma level. So there was certainly a clear gap. And as mentioned by Dr. Tan, medical care, patient care is actually a teamwork. And we have to narrow this gap, and hence why there was this need to produce experts in the allied health profession to narrow the gap. And simply, if even you look at the kind of medical equipment that was coming out in the market, you know, the MRIs and all that, we need to have experts to be looking at this very expensive machinery or diagnostic tools. Now, fourthly, there was a dire need to start producing more qualified lecturers to train the allied health professionals or personnel, because at that point in time, I think we were utilizing medical doctors, we were utilizing people with advanced diploma to train our allied health profession. But that was not enough. It would not be sustainable. We need to identify and get experts to be training these allied health professionals in the long run. More importantly, there should also be a recognition of the allied health profession as professionals. Yeah, because again, as I said, we have to realize the work that they're doing, the contribution that they can contribute in patient care and also in the medical procedures and so on. And last but not least, there was always the need to conduct research in the health sciences, in the medical sciences, because I think at that point in time, Malaysia was quite lacking. Even though, you know, we were very well known for our biodiversity, the richness of our flora and fauna, and yet very little, or if I were to say little, then it's not true. There's not much research to look at the richness of our biodiversity. And hence, I think research should become a big component in our strive to be equally at par with other more advanced countries. So this was some of the reasons, but I'm sure there were many other reasons why we had we set up the Faculty of Health Sciences. But I think it was the wisdom of our management at UKM at that point in time to look at the establishment of a faculty that would be working hand in hand with our other medical profession.
Okay, thank you, Tan Sri. Tan Sri, so during the first setting up the Faculty of Allied Health Sciences, right? So do you have facing any difficulties, especially to get this enough of the lecturers because they need a higher qualifications according to the MQA?
Well, at that point in time, there was no MQA. There was only LAN. And LAN was to look more at what the private institutions were doing. The public universities were left to do a lot on their own. But there were a lot of challenges, one of which is to look at the graduate employability in the public and also the private sectors for our allied health graduates. Yeah, because at that point in time, we know that even in the public sector there was not enough posts for some of these allied health professionals. Yes, yeah, it was difficult. So one of my main tasks at that point in time was to convince the Ministry of Health and also JPA on the possibility of introducing more posts for the allied health personnel. And I think, Alhamdulillah, both the ministry and also JPA had been very considerate, and it was little problem after that. But what would also be important would be the need to design and also to adapt to the most current academic curriculum that should be in place. And this is a real challenge. Fortunately, I think we will be able to work with our foreign partners. The medical faculty, for example, at UKM, had the external examiners who had been with us, and I was fortunate to be given a funding under CSHE to look at the allied health programs in the UK. So we of course have always this academic board that would always advise us on what needs to be done when it looks at the academic program. Also very challenging is the need to identify the lecturers for these new programs. And at that point in time, if you're lucky, and in the medical faculty, you have a group of people who can't be clinically trained, or they can't be scientifically trained, but with medical affiliation. So we were lucky at UKM. We have this diversity of academic lecturers, and we were able to utilize mainly people from the preclinical departments who came to join us at the new faculty. Then, of course, the need to identify the place for training. I think one of the main challenges in any health profession is to expose our students to the skill training, whether there were enough hospitals, whether there were enough laboratories, and this was a real challenge. But I think behind all this, we were also aware that at that point in time, we need to recognize, and I mentioned this earlier, the allied health personnel would be professionals on their own. And I'm glad that now there are several boards, professional boards that have taken recognition to some of our allied health professions.
Okay, thank you. So maybe we look at another perspective. Professor Dato Lokman is a clinician and ENT surgeons. Can you highlight to us the importance of other healthcare professions other than the doctors in the care of the patients, especially share your knowledge in terms of working as a team in your clinical work?
Definitely. Thank you. First of all, I would like to thank Tan Sri for joining our webinar today. Yes, Tan Sri was and is still my teacher. And we used to play football together. But I think my hair color had overtook Tan Sri punya hair color. It's very nice to be with you. Thank you, Tan Sri. Dr. Tan, yes, I'm really a doctor who would like to highlight the importance of healthcare professions in the management of patient. Maybe those earlier days, doctor is the doctor who treat patient, and the others are called paramedic. It's no longer like that. To give the best opportunity for the patient to get better with a lot of technology have to be used, new avenue of treatment. It has to be a team, and certainly that's the way now and what more in the future. Coming back to my own experience, in 1995, I wanted to start a new treatment for deaf children. It's called cochlear implant. Of course, people think, oh, cochlear implant, need a surgeon to put implant in, right? But it is not as simple as that. There's a need for these children to have their hearing tested, even at the age of 1 day. And for that, we need experts called audiologists. At that time, 95, orang tak tahu apa dia audiologist. But we have to have someone expert in testing the hearing of baby children, and then after the implant, they need to be, rehabilitated, where they need to have speech therapists or speech pathologists to train them how to speak and develop language. So I have to establish a team, and that team comprised of a surgeon, myself, and a few others, audiologists and speech therapists. In fact, in that team, these two so-called at that time allied sciences people play a very important part in the whole management of children with hearing loss. So I believe most of the other, ways management of diseases nowadays need to have this kind of teamwork. We now hear about all hospitals are not just establishing department; they are more of establishing center of excellence. When you want to have a treatment of someone with heart problem, you got to have the cardiac surgeon, cardiologist, cardiac physiologist, physiotherapists, and all that. So certainly, if you ask me, we need to have more appreciation and more, I would say, credit, to the health sciences personnel in the management of patient in the hospital and everywhere else.
Thank you for Dato's your inputs. So especially
pharmacists too.
Yeah, thank you, Dato. Appreciate for this pharmacist contribution, especially in this medical line.
Exactly.
Yeah. So perhaps it comes with this integrated one team. Okay. So also one of my friends is an audiologist at the hospital Pulau Pinang. She also always do this research by putting the rat with the high frequency
Loss,
test. Yeah. Okay. Maybe then we come to another perspective. Tan Sri Dato Dr. Salleh. For nurses, physiotherapists, radiographers, and many others, the training and certificates are offered at this diploma level in Malaysia. So currently there are discussions in the Ministry of Health and also Ministry of Higher Education that these important healthcare professions, like what mentioned by Dato Lokman, the importance of their contributions, especially during these healthcare services, it should be upgraded to the degree level. Many countries, including this Asian, have implemented this. What are your thoughts on this?
Okay. If I may be permitted, just to share with Prof. Lokman before I answer this question, the need to introduce programs which is important to support some of the medical areas, audiology and speech therapy being one. I remember in 1982, UKM set up its bachelor's in optometry, 1982, and with due respect to Dato Nomara Hakim, yeah, he was the head of ophthalmology then. We set up our program in optometry because there was a need by the department, yeah, to do the optometric assessment. But I think UKM also were or needed to train its own MLTs, yeah, the medical laboratory technologies. I remember my first task coming back from my PhD was actually to take care to run the certificate and diploma program in medical laboratory technology. And we had somewhat in-house training for our MLTs because we want to make sure that they are certified, they are accredited, and they will be able to assist us not only in the healthcare but also in research. And at that point in time, beside the MLT, the optometry, we also had audiology and speech therapy, and we also had nutrition and dietetics. Yeah, I think we were quite ahead in that sense. We had nutrition in the Faculty of Science in Bangi, and then we had dietetics in our KL campus, medical faculty. And then because of this, we felt that it was timely for us to be setting up a faculty. Yeah, and that's one of the reasons. Now, answering your questions, you know, whether there is a need to bring up all the allied health professions to a degree level. Well, if this is what the Ministry of Higher Education and the Ministry of Health is thinking, then it is quite commendable. Yeah, but I always believe there should be greater access to higher education, and it not be at the degree level only. It should be at the certificate level, it should be at a diploma level, it should be at the degree level, and it should also be at the postgraduate level. And I know there are a lot of students coming out of SPM who aspire to be health personnel, yeah? But because they do not have the necessary qualification, I mean, to do a allied health program at a degree level would require you to have a very good CGPA. Yeah, it's just like the medical; you have to have 4 flat to be doing the medical program. But
start with a diploma.
yeah, then I feel that, you know, there are a lot of the young kids who are very interested to do medical sciences, and they should be allowed to enter the diploma program and as they gather momentum, as they get more experience, for them to be able to be upgraded to a degree program. Those who wants to be admitted to the degree program, by all means, by all means. I mean, this due recognition by the ministry and the Ministry of Higher Education is very welcoming indeed. And then, of course, as mentioned before, is all teamwork. We need to have people at all levels. Yeah, we don't want people to be overtrained and refuse to do some of the menial works. Yeah, that is expected of them. So we need certificate nurses. We need certificate medical assistants. We need people at the diploma level to be doing all this, and we don't want any fingers pointing to us to say that, oh, just because this allied health professional is trained at the degree level, they will not be able to do all this menial work. Yeah, so I think there should be the whole spectrum of qualification that's needed for allied health. But I would like to reiterate that there should be a pathway for all these allied health professionals to upgrade themselves. Yeah? So there should be this pathway which would be which will allow this health professional, as part of their lifelong learning, to improve themselves. So good that the Ministry of Health and MOHE is thinking about upgrading some of its posts, but it's also important to think about bigger access and also the pathway of these medical health professionals. Yeah.
Thank you, Asri. So, Asri reiterate that the pathway of the continuously learning is important. Professor Dato Lokman. So when we discussing about these higher qualifications for healthcare personnel, there are also those who feel that degree and these higher qualifications are not so important when when compared to those with this very good clinical skill and years of experience are more important, are more prioritized compared to this education background or level. Okay, so to them, for example, a diploma nurse or the diploma physiotherapy is enough. Furthermore, they feel that if nurse have a bachelor or master qualification, right, or a pharmacist with a PhD, then they will be appointed to be this sister or matrons in the hospital, or head of the pharmacy department for a PhD pharmacist. So maybe we can say that this is a waste or not utilizing their knowledge or clinical skill. What is your comment about that, Professor Dato?
Thank you, Dr. Tan. I am very aware of this perception, especially working in the hospital, especially private hospital. Why do we need to have a nurse with a degree?
Yeah.
What more masters or PhD? Because sometimes it's coming from the doctor. Most of the time, coming from the doctor. I don't need this, highly qualified nurse. I need them to know how to assist me in the office. I want to stress that we need to change that perception. That once you are qualified as with a higher degree, then you're only fit to be sister or matron in nursing. No more, become a nurse in the ward. And if you are a pharmacy with PhD, or you have to be head department, or dean or something like that, I think is this perception has to change, because I believe that a nurse is always a nurse, whether you have a diploma, bachelor, or masters, and we like to. That's why I say we like to appreciate that extra knowledge, extra skills, and capability that they have, so that they will be, at par or even better than the doctors. If you, I still watch CNN, my favorite before sleep, you know. And during the pandemic, you can see they interview all kind of healthcare personnel. Now, interview a nurse, and the post that shared is she is a nurse in the specialized in ICU, or a sister nurse in respiratory rehabilitation, a physiotherapist in respiratory, of course, COVID all about respiratory. So they are still nurses, but because of their higher qualification, better knowledge and skills, this definitely will translate into better care, and they can discuss at the same with the same level with the specialist consultant on how best to manage COVID-19 patient from nursing perspective, from the pharmacist perspective, from the consultant medical perspective, and come up with a solution that is best for the patient. So I think we need to change the perception that once you are higher degree, oh, you cannot do all this bread and butter work as a nurse. Yes, you should do, but you do with a more quality outcome of your work, and you can train the juniors because of your higher qualification and skills and knowledge. That's what I think. Higher qualification mean to give better service to the patient.
Thank you for the comments from the Dato Lokman.
So if I may just add to this, in fact, this was one of the questions that had been leveled at me when I wanted to introduce the allied health profession program at the degree level. I always ask them, we need teachers. We need teachers to be teaching the certificate level and diploma levels. And we need people with higher qualification. We need people that would be able to transfer this vast knowledge to people at the diploma and at the certificate level. So these are people who will have enough experience and enough knowledge to be able to share it with the students. So I had this problem justifying, but I think finally they saw it and they felt that that was true. In fact, they were saying, oh, if you train a nurse with a degree, she would not be doing nursing work anymore. She would want to become an administrator. I said, well, it's not true. It's not true. In fact, I would love to see our nurses even going up and doing to do their PhDs. Yeah, because there's so much knowledge out there, and there's so much research out there that you should encourage your allied health professions to be seeking the highest degree and the highest body of knowledge out there.
So also according to my previous experience at the KKM at Hospital Pulau Pinang, so that time as a ICU pharmacist, so the specialists they also appreciate, especially the pharmacists in the work pharmacists with this master qualifications, so they can give some information, especially the drug interactions.
Definitely.
Tan Sri Dato Dr. Salleh, as a former chairman of the MQA, Tan Sri is very familiar with the mode of the delivery of higher educations and qualifications for healthcare courses. Can you elaborate on the opportunity for obtaining these higher qualifications, especially for working as a healthcare personnel?
Okay. As I mentioned before, I am a believer in lifelong education. And I'm also a believer that one can always improve oneself in any profession. In any profession. I think we have accepted the idea of offering greater opportunities for anyone to improve themselves. for quite some time now, the Ministry of Higher Education, MQA, have already started and have already embraced APEL, which is accreditation of prior experiential learning, which often an individual with working experience, but maybe lacking in academic qualification, to pursue their studies at all levels. Level 3 certificate, level 4 diploma, level 6 bachelor's, and even level 7 a master's degree. Yeah. So I think this is quite a monumental movement for the country to recognize that people with prior experiential learning can actually improve themselves. And I know some students are already benefiting from this. But of late, we are talking about micro-credentialing, where one could, I'm not an expert on this, but it sounds very attractive. It sounds very welcoming, where one could collect credits that they have accumulated and use that to be able to get them into the mainstream. So you could actually articulate yourself from collecting all these micro credits and then enter the mainstream, the mainstream academic with due recognition of what you have done. So this is another interesting perspective that I see is happening. But even before this, we have also taken recognition. Those with diploma and a certain number of years of experience would be given credit transfers. They are exempted from certain credits, and I think it's up to the institution involved how much or how many credits can they allow the students to transfer when they move from what they're doing to the main academic area. So I think there are already due consideration given to the allied health professionals to better themselves. Of course, I am encouraging people to go on online distant learning, to improve themselves, because they may already stuck in whatever they're doing now, but they would like to better themselves. And one obvious way with the new platform, then everything is gone digital now. And in this pandemic, we're talking about new normals and all that. That people should be allowed to do things online and graduate at a higher level what they're doing now. For the allied health professionals, it may be difficult because there are a lot of hands-on activities involved, but I have always
there's always a way.
Yeah, I always believe there is always a way. There's so many ways to skin a cat. So I am encouraging that our allied health professionals to take advantage of all these new platforms, new media, new teaching methodologies, approaches to be able to better themselves. If it is not for obvious promotion because you've got a better qualification, it's probably good for your soul. It's to seek as much knowledge as you can.
I just want to add, Tan, in KPJ Healthcare and Psychology, so we are doing some of this. Nak elan sikit lah ni. Boleh elan kan, KPJ. For example, our nursing, School of Nursing, we have diploma, and then we have a bachelor, full-time. Also bachelor, so part-time, where we give all these leeways where they can join the program, weekends and things like that. And then we have masters and also PhD. Similarly, our physiotherapy, we have upgrade program where they can get their bachelor from diploma to upgraded. Again, we take into consideration their workplace and all that, the posting. It can be done. They are already working in the hospital, so we can always accommodate and make the programs like that. They get their knowledge from the lecturers, but their skills are developed where they are working. Similarly, medical imaging. So yang elah lah ni siapa yang physiotherapy, nurses, radiographers with diploma, you're most welcome to look at our website, join our program to upgrade yourself from diploma to bachelor, and for nursing, even masters and PhD.
So in line to the answer and also Professor Dato Lokman. So in line to this ODL, online learning, distant learning, that now during the COVID-19 pandemic is encouraged by the KPT right now.
Yeah.
So actually in our KPJ Healthcare University College, like for example, Bachelor of Medical Imaging and also a Bachelor of Pharmaceutical Science, under the leadership of Dato, Professor Dato Lokman. So we are trying to move towards to this ODL. So we can leverage this platform, so that people during working, they also can pursue for their further study. So for your information, like diploma in pharmacy students, we also exercise the credit exemptions for the diploma in pharmacy students, so that they can enter to the Bachelor of Pharmaceutical Science modules, the program. And Professor Dato Lokman, Dato Lokman is the surgeon, and I'm sure that you headed a number of the committees and programs related to the patient management that need teamwork among this doctor and other healthcare personnel. And there are some feedbacks and complaints that in such a way that doctors are too dominant, or maybe too vocal or too dominant. And doctors always detected, so much so that other healthcare personnel feel that their inputs or opinions does not matter or accepted. So what is your comment, Dato?
I blame my fellow colleagues, doctors, for being too dominant. I agree. I agree with that perception, because, somehow when there is a team of healthcare professional, medical, the medical personnel become the leader lah, but there are very character lah, by right, the team leader should, appreciate contribution from all the members. In my case, from the audiologists, therapists, because decision has to be made based on consensus, on the experts' opinion of the various field of health sciences and also medical. But there are many instances that complain. I'm a nurse. What my opinion, does not, usually not taken up. Well, on one hand, we need to tell the doctors that we need to appreciate them. On the other hand, these healthcare professionals, that's why we have this webinar. They also need to upgrade themselves, their knowledge and skill, so that they can discuss, and if need to argue with the doctors who are too dominant. Sometimes they dominant, tapi actually knowledge dia taklah banyak sangat. For example, I did mention in the ICU. In the ICU, anesthetists are always dominant. They decide on what treatment to give. They decide even on what drugs to give. Right? And if you have a pharmacist who is also not that knowledgeable about drugs in ICU, then you can easily be dominated by the physician. But if you have a pharmacist who has a postgraduate degree or fellowship in pharmacy for ICU care, I'm sure you have the facts and figures in your hand and argue with the consultant. So you have to be two-way. That's why I think one of the objectives of this webinar is to encourage healthcare personnel to upgrade themselves, get better qualification, that so that you can contribute to the care of the patient. I think it's time to challenge the doctors, time to challenge the the decision making by the team leader, especially if the team leader is too dominant. My wife is a pharmacist, and she has a master's and interested in ICU and in nephrology. Initially, when she went for her ward round in the ICU, she would come back and tell me, this, I suggest this. They don't listen to me, But then when I showed them this kind of, I don't know what kind of drugs interaction and all that, and then with facts and figures, then that sink in the mind of the consultant. And this is what should be working as a team, appreciate each other contribution, and not to be dictatorial in the management of patient, because ultimately it is the care of the patient that's more important, not yourself as the team leader. That's my my advice to doctors lah, my colleague, and appreciate the contribution of your health sciences colleague. At the same time, health sciences colleague need to push them up with knowledge and qualification at par with others.
So further to the Professor Dato Lokman, so I remember during about 15 years ago, when I was an ICU pharmacist at Sembang Hospital. So the specialists there always went to work round as a team with the specialists, MO, pharmacists, nurses, etc. So we go work round, and then the specialists also will ask, especially to the pharmacists, about the dosage, the interactions, and sometimes during the noon work round, right? Then the medical officer sometimes they will not accept the pharmacist's opinion. Then we will print this evidence, especially from this drug information, and show to the specialists. And specialists, in fact, they are more appreciated and accepted compared to the medical officer to these healthcare opinions.
There are such doctors who think that they are the boss all the time.
Okay. Tan Sri is a medical microbiologist, and your research work, scientific papers, and publications in both medical and health are tremendously outstanding. Could you share with us how you achieved this, especially on the importance of the research for healthcare personnel and contributions to the medicines in general?
Okay, I could answer it as a one-liner, because an academic, you either publish or you perish. And I think that is very important, especially now. A university like KPJ being upgraded to university college, they have to have research. As an important component, especially so in the MIRA assessment, in the SETARA assessment. But I always believe research is a very important component of any body of knowledge. If you are involved in a certain body of knowledge, you have to do research. You have to look what else you need to address to be able to generate new knowledge. But I have found out that meaningful research is always achieved through teamwork. This is what I think Prof. Lokman was trying to allude. You need to identify problems in a group. You need to try and brainstorm and find out what would be the way forward if you want to do research. And as I said, it would be giving a more significant impact if your research is actually addressing what is right in front of you. But as I said earlier, in any areas that you are involved in, research should become the mainstay of whatever you want to do. And hence why I think if you go on to do your bachelor's degree, there will be a small component of research module. It's much bigger when you do your master's, and it's bigger still if you do your PhD. And it doesn't end there. It doesn't end there. Because people with PhDs would go on to do a postdoctoral experience, yeah, to do a lot more research. So I think there should not be any full stop to research. Research should go on, but I think in Malaysia at the moment, there's a lot of opportunities to do research. With this pandemic, it opens the floodgate to do all kinds of research, and it involves all kinds of personnel. It's not only the medical, but also the health sector. And I think Dr. Lokman has alluded this. I'm also following CNN almost every night, but it's interesting. It's interesting. It looks like the inputs are coming from all expertise, and I think this is how they can plan strategically how they're going to move forward. So at the end, there should be no full stop. At the end, if you do your masters and you do your PhDs, there will be a lot more research component. And at the end, I think everyone will benefit from this.
Thank you, Tan Sri. Pertaining to the Tan Sri comments on this teamwork from these doctors and the healthcare allied health for the research publications, perhaps maybe Professor Dato Lokman can share the KPJUC, the AHC concept, this academic health center concept.
Okay, yeah. At KPJUC, KPJUC is affiliated with the largest healthcare provider in Malaysia, which is KPJ Hospitals. Yeah. And we are now actually intensifying the collaboration between KPJ University, which are the lecturers who are majority healthcare sciences professionals, with the professions in the hospital. They need to have greater collaboration between the lecturers who are, for example, physiotherapy lecturer and the physiotherapists at the hospital.
Yeah.
And through this collaboration on integration, there will be better, research, publications, and ultimately better patient care. So this concept is what we call in the West academic health center, where hospital is not just giving service and university not just giving education. This collaboration is at the hospital level, working together, integrating with the academics and the health sciences professionals is what we have established. We call it academic health center. Of course, we don't have to call it, this is hospital KPJ academic center. We have started this work in KPJ, focus on KPJ Sembang, where this kind of collaboration, and there's evidence that more publications, more research work coming out from this kind of collaboration.
No, I would like to add on that. I would encourage that this collaboration would be extended to other institutions as well. Yeah. I mean, KPJ is one big institution, but there are other institutions, both in public and private, which are looking at healthcare profession, and there should be a greater teamwork. Malaysia is not big. I mean, I think the more collaboration you have, the more integration that's happening, it will be better for the whole country.
Thank you for both panels' input. Professor Dato Lokman. So there may be many students, diploma students, bachelor students. I saw that from the comments, there are many of the KPJUC students there. So in the healthcare courses attending this webinar, so what will be your advice to them and your opinions with regards to the development of the careers in the healthcare other than the medicines?
Thank you. Probably this is the last opportunity for me to campaign for health sciences. The future of healthcare profession is great. It's vast.
Yeah.
You know, there are many areas in healthcare professions, in healthcare field that's not been explored. You know, if you look at just simple nursing, Tan Sri, how many nurses in Malaysia has PhD? Less than 10, I was told, you know, or probably more now, and what about the other field, you know? So my advice to our students is, yes, you may want to start with diploma or degree, but the future is bright for you if you want to go into higher qualification, higher degree, and you can make yourself create a legacy, for themselves in health sciences, in the courses that we mentioned just now, yeah. And the development of health sciences is really vast and very fast. So take this opportunity to our students, and even to parents. You know, my advice to parents: when your son and daughters want to do, health sciences, medical, don't stop at just being a doctor. Doktor pun sekarang ni banyak kata dah oversupply. You know, encourage. I would like to see bright students, with 7 A's or 9 A's, taking up all these courses, speech therapy and others, so that they can really raise the standard of the profession in that field. Bright students should not just think of medicine, pharmacy or dental or others, the glamorous. There are many opportunities to venture into in health sciences, and this evidence in this pandemic, where contribution from all the health sciences are important. And if you are that person who is the expert in that field, be it a physiotherapy, be you other physiotherapists or a nurse, you will excel, and people will recognize you. So that will be my parting words lah for our students, for our parents, and those who has just set for their SPM. Think of health sciences as a career, but don't stop at the level that you think it is now, diploma. Maybe parting word also from Tan Sri.
Yeah, I mean, this is a great opportunity to advertise about health sciences.
Yeah.
When I was with the United Nations University, we were always talking about the MDGs, the Millennium Development Goals. And for health, we were always talking about universal coverage. Universal coverage, which means that they would love to see all the whole population being covered with good health, facilities, and also deliveries. So in Malaysia, if you look around, there are a lot of opportunities for the medical health professionals to be involved in. I'm talking, recently we had a big outbreak of COVID-19 in the factories, in the industries. There should have been a better occupational safety and health measures put in place. That is going to be very important. Also talking about a pandemic, we would also like to see a lot of environmental health officers doing their job. And of course, in the country that's aging, we're talking about the old age population. Geriatrics become very important. Of course, Japan is very way ahead, and I think they have their own agenda to take care of their old age. We're also talking about mental health, yeah, which I think is not well addressed. Yeah. And of course, we would love to see the alumni. The alumni is a very strong group. Well, I'm sure KPJ University alumni are all set to find out what else they can do. And it'd be very nice if you think about being able to continue learning. Yeah. Well, it may not be in KPJ, but it could be anywhere.
Hopefully in KPJ.
Well, hopefully. but when I completed my PhD, I felt it wasn't enough. It wasn't enough. Yeah. So we need to be seeking a lot more knowledge, because there's a vast area of knowledge that needs to be researched, that needs to be explained. So there are actually a lot of these opportunities that will come knocking on your doors. Yeah? So my advice would be, as I said, it has got to be a lifelong learning. I think even in Islam, you say you want to gather knowledge until you die, or you travel even to China to seek up your knowledge. But there should be no end. There should be no end. There should always be this hunger for generating new knowledge, and I think that would be self-satisfying at the end of the day. How much knowledge can you gather? So I would love to see a lot more people coming back to do their bachelors, to do their masters, to do their PhDs, or even to get other professional certification. What is becoming important now, we would love to see some of our local programs being accredited and also being recognized by other professional bodies overseas. Yeah? So that, I don't know, one day we could find a lot of our health professionals also working overseas. Yeah, working overseas. I mean, we know nurses have gone to the Middle East. There are a lot of Filipino health personnel in the Middle East. So we would like to see that we are not only producing health profession for local consumption, but also for the overseas market. Yeah? And hopefully hopefully they don't settle in those countries, they will come back and bring greater knowledge to Malaysia. Yeah. So my hope is to see this happening, and well, it's up to you. The question is up to you.
Thank you, Ashley, and thank you, Prof. Dato Lokman. So in a nutshell, education doesn't come to an end once people are in the middle of their professional career. Learning is a continuous process, not an single episode event. Continuous learning is a pivotal key to success. We know that healthcare industry is a very competitive and a dynamic environment. So we believe that a skilled, motivated, and with these higher qualifications, medical staff that is always up-to-date knowledge is a huge competitive advantage. So I mean, nowadays we can see that many of the healthcare professions with these higher qualifications, for example, in the pharmacy field, we can see that in the KKM side, many of the clinical pharmacists, they have this master and PhD qualifications compared to about 1 or 2 decades ago. Yeah. So perhaps I would like to share a quote: "Do not stop learning just because you graduated from university. Aim to continue to learn, unlearn, and relearn." Okay. So perhaps we saw that from this Facebook there are some questions. There are some questions from this.
I don't think we have time.
Yeah. Okay. Or maybe we can answer 1 or 2 questions from Dato. Okay. maybe we can answer these questions. Katrina, may I ask from this
Catherine Ross.
Katrina Ross. Katrina Ross. May I ask, certain higher qualifications are not accredited, recognized in our country, but is really valuable and needed in other countries, especially in the Western. It is going a dilemma that still has no solution until now. How do we go forward about this?
Well, it's a very good question, and I think a lot of us have faced this before. The best way of doing it, I think, would be to seek an audience, with the Malaysian Qualification Agency, with the Ministry of Higher Education, and even perhaps later to the Public Services Department, JPA, to solve this. I'm not sure what area qualification it is in.
Right. We're not in the position to know what field and what's the expertise. Perhaps.
So normally you would like to seek advice from these three agencies, and find out what needs to be done. I'm not sure whether the program is not recognized or the university is not recognized. So it will throw you some light if you were to go to JPA, and they will advise you, because they would have a glossary of accredited universities all over the world, and the various kind of programs that they offer. So there is no mention about the university here. There's no mention about the program here. But my advice would to go to JPA, and also to NQA, and also to the Ministry of Education. Go to JPA first.
Okay, so it's more than an hour webinar. So with that, we end today's webinar sessions. And I would like to take this opportunity to thank both this speaker today. Thank you to Tansri, Dato Dr. Salleh, and also Professor Dato Lokman for your informative sharing. So I really appreciate the time that you have taken to share your knowledge with us. And also for all the audience, as well as the students in front of the screen, thank you for your attending to these webinar sessions. And also we would like to take this opportunity to thanks to the site, Mr. Imran and the team, Students Affairs, Mr. Musa, and the organizing committee. Okay, thank you. And we will have more webinar soon.